Where to put the call bell for a patient who is bedbound? Well, it seems pretty darn obvious, doesn't it? Of course, you always want each patient to be able to call for assistance when they need it. So even though it's really obvious, let's review some tips on making sure that every patient has that safety button. And if you haven't done it in a while, close your eyes and pretend that you're the patient. Consider what it might be to be in bed for several hours and you couldn't get help, and what that might feel like. Pretty uncomfortable and even scary. Okay, so I'm going to start talking about the patients who are unable to use their hands. Maybe you're ALS patient or a stroke patient. Please know you can get and use adaptive advices. There are these flat pressure pads that allow a patient just to move an arm or put a foot on top of it to signal the need for help. There are even voice-activated systems these days. And at home, you can improvise with a wireless doorbell or perhaps a baby monitor. I've even have families hang jingle bells on the side rail, so all the patient has to do is bump against the railing to get those bells to ring. Now, back to the usual call systems, the ones that have push buttons or pull cords. First of all, most obvious, you've got to place the bell within the patient's reach. And do put it, think about this, on the patient's stronger or more mobile side. And of course, you want to put it close to the hand that they move more easily. Test it with the patient. Ask them to demonstrate reaching and pressing the button. They may be able to reach it and press the button, but not hard enough to actually activate it. In that case, they need a different system. When I admit a patient in a facility, I always test the bell with the patient, have them press it, and then we just wait to see that the staff will come and ask for what's needed. Make sure you secure the cord so it's not going to slip away or fall on the floor. Clip or tape the cord to the sheet, blanket, pillow, next to the patient's shoulder or hand level. We don't want it dangling off the side of the bed. If there isn't a clip, I like to use a piece of tape that you fold over the cord and then use a safety pin. You can pin it right to the patient's gown or next to their hand. Before you leave, you must make sure that it hasn't fallen behind the pillows, the bed, because you're positioning the patient, you're taking care of them, and of course then you forget to put it back. So keep it visible, always easy to identify, make sure the patient can see it, not just feel it. Some facilities even place a small label or a bright colored band on the cord for visibility. But again, recheck every time you check that position, reposition them, or provide care. Make sure that they can get it, especially for patients who are weak or have trouble using their hands. Thank you so much. Get our booklet, watch our videos. I'm Nancy, one of the Hospice Care Queens. Our motto, care is treatment.